session for the afternoon is titled Behavioral Challenges in Children. It's a panel discussion. The faculty is Dr. Ajay Srivastava and the panelists are Dr. Pungodi Bala, Dr. Vinodini Subramaniam, Dr. Soma Sundaram and Dr. Subhash. We request the faculty and the panelists to please arrange themselves on the dais.
Good afternoon, and before onset, let me thank organizing committee for giving us this opportunity. And after lunch session, it's fairly difficult to do the task. And our topic is behavioral challenges in children. And I invite our panelists. Dr. Subhash sir. He is professor and head of department SRM Medical College, Hospital and Research Center, and he is president IAP Chengalpattu, and he has numerous awards and affiliations to his credit. And then I welcome Dr. Soma Sundaram. He is chief mentor and co-founder of DSOL Child Development Center, Adyar, Chennai. And he was executive member of CIAP in 2020 and 22. Along with me, he was my EV colleague in 2020. So he was secretary IAP Tamil Nadu State Chapter of 2017 and 18, and he did wonderful job. And he during his tenure, he presented the SCOP module, which is All India hit. And we hope in the coming years, this SCOP 2.0 is being launched as he promised me. So we have Dr. Pungodi Bala, and she is a psychiatrist, child and adolescent psychiatrist and Kaizen mind care, and her area of special expertise include autism and all behavioral problems and developmental problems. And last but not the least, Dr. Vinodini Subramaniam, who is American board certified behavioral analyst and consultant of Inversion Child Development Center and Center for Behavioral Analysis, Salem. Can I request organizers to please put the timer to 40 minutes as it was promised. Okay. So, before going further, let us discuss what is behavior. That is the basic thing. And what is this behavior? Behavior is refers to full range of physical and emotional behavior that humans engage in and are influenced by culture, attitudes, values, ethics, authority, rapport, persuasion, coercion, and genetics. So, when does it become challenging? When it interferes with children's learning, development, and success at play. When it is harmful to the child or other children or adults, and it puts a child at high risk for later social problems or school failure. Why children behave inappropriately? Because the behavior is working for them. This is to avoid a situation or escape from a situation or person, to obtain an object or attention, to change level of stimulation. And you can see a lot of factors, including your health factor. Yeah, it's not working. So, feeling unwell or basic needs, whether new routine, new baby, lot of things are playing that influences the child's behavior to become challenging. And so my first question is to Dr. Soma Sundaram. Please discuss challenging behavior in context to developmental disabilities and disorders.
Thank you, Dr. Ajay. So why we change our behavior even in the adults? So why we change our behavior? Next two slides. Yeah. So either we change our behavior because we have some emotional deprivation, or we have a physical deprivation, or we are socially deprived. So we'll see one by one. When we are emotionally deprived, when we show some temper tantrums because the child is not able to, like what I say, speak and then express this anger, it shows a temper tantrum. That's an emotional deprivation. Breath holding spell is one form of emotional deprivation. Lack of sleep is an emotional deprivation. Nightmares, night terrors, somnambulism, bruxism in children. That is because of a daytime anxiety and the child gets an emotion during the night time. When you have a physical deprivation, when you are physically isolated, you don't know what you do during your physical isolation. You go for a physical deprivation, and this behavioral disorders come into place. These are enuresis, encopresis, tics, nail biting. When we are physically left behind, we start biting our nails. A pica, a thumb sucking, all are means of physical deprivation. The third comes the social deprivation. Yeah, social deprivation. So somebody in the society may think bad of me, or something which do for the society, or the behavior is changed by the society. Juvenile delinquency, school phobia, afraid of the society, the school society, stealing, something we do from the street. So previously.
Yeah.
Yeah. So lying, aggressiveness, sibling rivalry, all these repeated failures, all are causing a social deprivation and make a change in your behavior. So these are the various core things which can cause a change in your behavior, and these are the common breath holding problems which are known in early childhood: pica, bedwetting, thumb sucking, breath holding spells, temper tantrums, tics, bruxism, and those things. And this behavioral issues change from period to period. The early childhood behavioral issues are this, the going on to the next. So we have the preschoolers, you have the autistic children, we have an ADHD. ADHD, we call it as a disruptive behavior problem. What we discussed before are all the challenging behavior problem. So you have a disruptive behavior problem in older children. So they go for contact disorder. This is a disruptive problem. All these things. So in adolescence, you have a separate group of problems: a depression, a substance abuse, an impulse control disorder, anxiety disorder. So the behavioral issues changes as the child grows and grows. So that should be the thing. And the main cause of behavioral issues are change in the social or emotional or physical deprivation. Thank you, sir.
Yeah.
And this is the final slide. Behavior that occurs, when will you call it as a challenging? When it occurs at a high frequency or high intensity, or in the presence of different caretakers, or in multiple environments, is suggestive of a behavioral disorder. It becomes a behavioral disorder.
So, what do we feel that post-COVID especially, the problem has increased in recent years? So there can be many factors. Dr. Subhash, would you like to discuss about these things?
Yes, Dr. Ajay sir. Before the pandemic, the study conducted by the UNICEF and the Global Survey of Childhood Support, they found that 1 in 20 children and adolescents have behavioral problems. But after the pandemic, this as the child anxiety and the emotional distress has increased. So the anxiety problems and the depression incidences rise from 30.8 to 28.2%.
Almost it's increased about from 15 to 20% in different studies to 30 to 40% in recent studies. So there is a huge increase. So what are the factors you include?
So the change in the social dynamics, that is the change in the environment and the personal confinement and increased peer pressures, and there will be increase in social media devices and exposure to violence and exposure to inappropriate contents, and increase in use of digital devices, and the academic pressures and peers pressures, and along with the lack of social and emotional support, and the decrease in spending time of parents with the children. All this has contributed to increase in the incidence of challenging behaviors.
Yeah, thank you. So we see that definitely the incidence is increasing to an alarming extent, and we should have some more talks regarding this. So how much parenting style is responsible for behavioral problems in children? Dr. Pungori.
Good afternoon all. I think you can hear me, isn't it? Okay. So we all know that the 4 types of parenting style, just to quickly go through it. The permissive type is it's a simply pampering the child. We will say yes to everything. We have seen lots of upper middle class parents in that group in my clinical practice, including the doctors and IT professionals. Then the next one is uninvolved. It's very rare, but still it is there in the social deprived status. Even very high rich status as well, because the kids are, I think we will see that the parenting presence should not be replaced with present, which is a gift. But this is what happening in many of the families. So in uninvolved parenting types, kids don't get any attention, they'll be neglected. Then authoritarian type, it's only like military rules. They just focus on only the discipline. They don't have any emotional connection between the parents and the children. Sorry, sir, the previous slide. Okay. Then the positive parenting type, we all know that is an authoritative. It creates the positive relationship and enforcing the rules. The next one, sir. So how these parenting styles affects the children. In permissive type, the kids will be very impulsive, demand a lot, they'll become very selfish, disorganized, they lack responsibility and they lack self-regulation. Even in this type,
Please carry on.
then the authoritarian one, they tend to be well behaved but may struggle with the shyness, unable to make their own decision. They'll be aggressive. The most important point is it will lead them to rebel against the authority figure when they grow older. It is happening in many of the families with the adolescents. Nowadays, I think the kids are hitting the parents, especially in authoritative parents. Usually they are very good, as you know that. Usually in this triad, I think we have to put another arrow mark this as well. It's like a vicious cycle. The parenting style, behavioral problem, the negative, the parenting stress, it all goes as a vicious cycle.
Thank you. So, to approach towards this challenging behavior, we have to understand the behavior. Dr. Vinodini, how do we understand, how this process you perform? How do you understand this behavior? Can you explain this?
Thank you, sir. Good afternoon, everyone. So, when we first come into the contact, like the parents or the family coming to us, like they will narrate the behavior. So, a complete descriptive narration can be taken in the form of a history. And sometimes we even write the behaviors like behavior number 1, behavior number 2. Like that, the form of the behavior, the topography of the behavior, the context where the behavior occurs. Sometimes if the behavior occurs like when the parent is telling a child to do a task. See, that shows us that maybe either the task is difficult or the child is not having enough support or motivation to do the task. So by having a complete data of the frequency, the intensity, the duration, the context, and also there is an important mapping which can be done, which is called the antecedent behavior consequence mapping. So we ask them to narrate the behaviors, and also the antecedent is what happens before the behavior. So those are the triggers. And what is the consequence? So what is the family or the parent? What is the consequence they are giving? So in that way, like we will be able to do an analytical basis and arrive at a better understanding of the functions of the behavior. Next slide, please. So sometimes even it is better if we go to the environment where it is happening. Certain behaviors will be observed in the classrooms. Certain behaviors will be observed in the social settings like a playground or in a peer groups. And it is better we go and observe those behaviors there. And we can even take an anecdotal data, and according to applied behavioral analysis, we have a complete evidence-based approach which is called the functional behavioral assessment.
Yeah, functional behavior.
So which basically common 4 functions which we see is attention maintained behaviors, escape behaviors, tangible access. Suppose that is very commonly seen nowadays, like in the living room of every family when the child wants a cell phone. So there is literally a tantrum which is being observed when the child wants a cell phone. So by narrowing those functions, we will understand the behaviors better and we could guide the parents with better plans. Thank you, sir.
Yeah. Please describe in short strategies to manage challenging behavior in young children. How do you change the behavior? Dr. Subhash.
So treatment is effective if only the child's need and the family needs is met. So first, we should not go by our experience. We should have a comprehensive evaluation by a mental health professional is needed for the right diagnosis. For younger children, the treatment with the strongest evidence is behavior therapy training for parents.
For parents, yeah.
For parents. So where they help to strengthen the parent-child relationship and respond to child's behavior. For school children and teens, the effective treatment is a combination of training and therapy that involves the child, family, and the school. So this is a pyramid model which is evidence-based, which helps the child in social, emotional, and behavioral development in the early years. So there you have a universal promotion by nurturing an effective caregiving relationship with a high quality supportive environment. And the secondary prevention is targeting on the social and emotional support groups. And tertiary prevention is intensive training for those with the challenging behaviors. These are the things we have to focus while on the child having a challenging behaviors. So first, modifying the antecedents by changing the child physical environment, teaching effective communication skills, modeling appropriate behavior, effective instruction by parents, gaining eye contact and receiving verbal assurance. So we have to have certain limits and consequence should be clearly defined. So variation of the reward is essential, and negative attention is powerful as positive attention. So these are the reinforcing effects where we can give a social attention to the child, praise, comments, and tangibles, and privileges which can help in reducing the challenging behavior. So that for a behavior therapy, we have to, if there is no change by about 4 months, we have to go for a re-evaluation and give a intensive training, or we have to give a full evaluation by a medical health personnel. So this is a mindfulness-based intervention. This was a study conducted in 18 places, and the meta-analysis showed that the study revealed the effects of mindfulness-based intervention on the child's self-regulation in the form of emotional, behavioral, and cognitive regulations. They found yoga-based mindfulness and MBA combined with social emotional learning, which were observed by the teachers and the parents, helps in decreasing emotional distraction and cognitive rigidity, and thereby allows self-regulations in the for the behavior, emotion, which helps in the decreasing the challenging behaviors in the early childhood.
Great. Few words about parental skills training, Dr. Vinodini.
So parental skills training seems to be so much of empowerment to the parents, and as sirs have told, like once the assessment part is finished and the follow-ups are done, and parents are requested to come inside the session sometimes, and once the behavior intervention plans are created, they can see the plans being run with the child, and also they can be shown how much successful, so that they become motivated and they become positive to carry it at home, which really helps the therapist and the therapy rooms.
So,
yes, parent skills training basically involves the parents to understand the behavior. More often, like beyond explaining the behavior, why the behavior happens. So those context and the environment and the consequences can be educated, and the parents can be taught to give alternate consequences, so that in that way behaviors can be modified.
There are some repetitions. In fact, repetitions are intentional just to make the point more and more impactful. That Dr. Pungodi, you talked about parental discipline. So how do you discipline these problematic children? What are the discipline basics?
I think we all know that, I think we can skip this slide, we'll move on to the next one, that has got more point, okay. So the first thing, we all know that what the parents should do, obviously when the child behaves inappropriately, they should be calm, because
please speak loudly.
Sorry, hello, okay. When the child behaves inappropriately, what is happening in reality, I think the parents are also getting stressed. They are raising their voice. At the end, it will end up in having big argument. In my clinical practice, I could see that there is lots of violence between the adolescents, even for 4-year-old, 5-year-old throwing things and all. So the first thing, parents should be calm. When the child behaves inappropriately, just let them express their feeling. Maximum when it starts, it's only the verbal kind of aggression. But when the parents start saying that, stop it, how dare you can do this, you don't show me any respect, then that will turn into violent behavior. So the first thing we need to teach them, when the child is aggressive or shouting, be calm first by parents itself. Because we are allowing them to express their feeling, we are validating their feeling, whether it's wrong or right, we'll discuss it later. Then obviously we know that we have to set up the ground rules and all this, like when the behavior goes wrong, what we have to do, these kind of things should be discussed in a previous manner itself. Then another thing is, we shouldn't do certain things, like I meant parents, like the comparing with others. Most of the time, parents are not comparing with the other kids. The parents are comparing their own spouse. Mom blames the dad, dad blames the mom. This is happening.
In fact, teaching discipline it's discipline in itself.
Yes.
So because
like,
all
when they don't
behavior is
behave well,
communication.
you are like a mom. When they behave well, you're like a dad. This is what is happening. So we should change that. Then how do we manage the specific behavior? If there are lots of behaviors that are going on, first focus on the one behavior first. Then give a space to them, express to them, then explain the consequence of it, even that some of the consequences are natural consequence. For example, if you watch TV for a longer time, your eyes will be affected, your concentration will be affected, that's why you're getting violent behavior. So if we explain to them, they will listen to this. I think the ABC approach is already covered.
Yeah.
The next one.
Thank you. So moving on, how would you manage young adolescent with challenging behavior? Dr. Soma.
Yeah, so then adolescent, we all know it's to be managed in a quite different way from children. So as such, to be a good role model, the parent should be a good role model. You should have an adolescent, the training should start. A behavior means you should have a plan, you should have a training in the early childhood itself, so that the adolescent will have a good course. The proper parental care should be there. Whatever the basic needs of the child should be there. The parent should fulfill the needs of the child. And the parenting style, which the previous panelist has also described, that also means how this behavior will be there in the adolescent. So this already has been dealt with. So how the parent has to be.
Yeah, the principle for young and adolescents remains same, except that in fact a power struggle that comes there, and you have to avoid power struggle. You have to communicate in such a way that it should just make the child more calm. And you please talk about that coping skills. No?
Yes.
Yeah.
So the adolescent, the most important thing will be teaching them the coping skills. So because they will be impulse related, there will be lot of social negative things will be there. So how to cope up with these things? So you have to like what I say, take a deep breath, you take a walk when you are exposed to something, read a journal, listen to a music, draw something which you have a passion, write a poem, or sleep for a few minutes and then take a break and then come back, change your thoughts by different ways, whatever you are possible. And okay, fine.
Okay.
So stretch yourself, watch a movie, call a friend, whatever may be, a meditation, all these things which we all know should be reinforced to the adult, because such things can change the behavior of an adult. The final thing will be involve all those professionals who are very, very important. A behavior analyst should be there, a psychologist to find out the real picture, the psychiatrist to treat the problem, the speech language pathologist, the staff. All those people who will be involved, the multidisciplinary team should come into the treatment and the behavior management of an adolescent.
So, do you think that how a teacher can feel when a child with challenging behavior is in its class? He may think that the child does not belong here, and I do not have the training to deal with him, and so many. In fact, teacher himself gets frustrated, and it becomes a problem for a school as well. So we have to keep teachers and all educational part in loop, because a child spends almost 1/3 of his time in a school. So what educational strategies to teacher you would suggest, Dr. Pungori?
Well, I'm sure all of the pediatricians will go to school, lots of awareness meetings are happening. I would like to emphasize that one point, based on my clinical experience, I get these particular words from adolescents patient. They are saying that my teacher is saying that my parents are saying that you're a waste, you can't do anything when compared to other person. So ask them, especially this integrated coaching classes and all, know, they will say that if you don't get that particular mark, you can't get the free seat, then you are wasting the parents' money. So when the kids hear these kind of the negative words, they are in guilty feeling, they are in depression, then they don't have any motivation. So please emphasize that, say some positive words. For example, rather than saying that your mark is very bad, they could have said, it's not good, you would have done better. What are all the things you need to improve? So that positive words, it needs to be there, because most of this negative words leads to lots of suicide as well, because kids come to me with suicidal thoughts because parents said this, because my teacher said that. Then obviously we all know that they should have the school policies or classroom rules, then reward chart and all. It will work in the primary school, it will not work in the high school. By this time they should be trained. The next slide, sir. Then obviously the teacher should be a role model. Just one simple incident. One child asked me, 8-year-old, doctor, you said that we shouldn't revenge them back, but my teacher, accidentally one of my friend splashed the water on the teacher. The teacher took the other bottle, just poured it on the other child. So this is wrong. No, the 8-year-old is asking me, but many of the time parents or the teachers, we are not being the role model to the kids. So the children don't listen to us, we all know that, but they'll copy the behavior. So we have to emphasize this concept as well. And many teachers are using the mobile phone during the classroom as well. So the role of school management, obviously it takes an important role. First of all, the teachers are really stressed. They don't have time to deal with the kids' behavior, because all the moral value classes and 0 hour, because some schools are having the 0 hour period in the initial 40 minutes, so that the class teacher can spend time with the kids. They'll know better about them so that they can correct their behavior. But nowadays these moral values classes are replaced by maths or science classes. So we should emphasize that they should have those classes, because the study is important, more than that the behavior is also important. Then the school management should have the school counselors, definitely. When the behavior goes wrong, the class teacher can't handle, because they have to handle other 30 kids. So there should be some special school counselor or the school mentor to deal with the behavior. That's what they need to arrange.
Yeah, that's great. That's great. Now, whenever we talk about behavior therapy, there comes cognitive behavior therapy. Few words about cognitive behavior therapy by Dr. Vinodini ma'am. Yeah.
Thank you, sir. As the word indicates cognitive, we all can narrow that to the cognitive part, right? So, identifying, this is a form of a psychotherapy sessions, which happens between the psychotherapist and the teenager or the client. So here the therapist helps the client to identify the negative thought patterns or the faulty belief systems or the limiting belief systems, which is creating those behavior patterns in that particular client. And by the end of the session, like acknowledging the thought patterns and redirecting those thought patterns to a meaningful behaviors or activities. So it is popularly known as the 3 C's. You have to catch the pattern, you have to check the pattern, and you have to help and empower your client to go for the change. And that helps in the behavior modification. So this cognitive behavior therapy, CBT popularly known as, this develops more rational thought process. Sometimes a faulty thought process have illogical roots. So now we replace it with more logical, more rational patterns over there. And by helping them to replace those thought process, there is a positive behavior, there is a more self-esteem, and it helps the client to remain more positive, optimistic, and also to progress both in their career as well as in their personal lives.
Thank you. So, how can technology help in managing behavioral challenges? In fact, in morning today there was one session by Dr. Shefali Gulati regarding these advances in technology, and tomorrow we have one more panel in technological advancement. But in context to behavioral challenge, and I think that this part should be very interesting, so all should focus on what Dr. Soma Sundaram has to say. Yeah, Dr. Soma.
Yeah, so technology has revolutionized everything. And you have this mobile mental health and wireless technologies where you can monitor and treat behavioral health conditions anywhere from the country or anywhere from the world. You have tele mental health technologies that provide consultation. You can take a consultation from a doctor in Chhattisgarh or Delhi, assessment, treatment, and supporting over real-time electronic. And AI and machine learning technologies have revolutionized, and in the future they are going to be the thing. And all these are digital pathways. They can provide virtual consultation, they can provide online therapy and counseling, which we saw it during the COVID period. Many centers sought to online occupational therapy, speech therapy, and those things. Diagnosis and self-help apps are available. Online support group sessions are being done. Deliver the therapies over phone. They send the therapy over WhatsApp and those things on a weekly basis. They track the patient progress digitally. Finally, you have meditation apps, because apps have revolutionized a lot. And we have various tech tools, this social scale training apps, sensory apps, relaxation and mindful apps. We have wearable devices also. Whenever you become anxious, they show your heart rate and your BP are increasing, and those things are also have revolutionized this technology has revolutionized. And this is a very important thing, because behavioral trapping app. So we have few things, but I found these two very nice and interesting. iReward Chat. iReward Chat is an Android and an iPhone app. A nice tool is a simple and interactive interface to keep tracks of kids' behaviors and course. They have all these charts will be there, all these stars you can give them. So this is available. And thumbsters also. You can keep recording a check on the child's behavior. They will automatically give whatever the score and those things if the child's behavior is good and those things. So behavior tracking apps are very, very important. You can teach your parent how to install these apps and how to search these apps and have it in their mobile phone. And we have apps also for giving cognitive behavior therapy with what Dr. Vinodi madam was telling. So you have all these apps. When I Googled these things, all these apps came into the film, and they have their own pros and cons, but go ahead and do which comfortable to do. We have virtual behavior therapy can be done. And virtual reality. Virtual reality is revolutionizing a lot of field. So virtual reality can easily diagnose an autistic or ADHD child, which can help calm down and bring more attention in a child with ADHD also. So this is what which I was telling about virtual reality programs. And
but at the same time, what's your take up on this? IAP guidelines we just restrict screen time, and we are using these much of apps. How would you balance that?
Yeah, so the thing is, what IAP is saying is 2 to 5 years and more than 5 years, it should be a supervised things. So you should not give the mobile phone to the child, go ahead, whatever you want. A child with an autistic behavior, mother comes and says, he can Google through whatever and he can find what YouTube and those things. So it's not that
it should be under close observation.
It should be for educational purposes.
Yeah, and it should be under close observation. Exactly. Every time you give mobile to child, someone should observe what is he going to do with this.
Exactly. Okay. So you can lock those things which are all not to be accessed by the child.
Okay, so now whenever anything comes, we being a doctor, we have to prescribe some medications. So what are the role of medication and what is your choice of medication, Dr. Suhash?
Yeah, so first of all, we have to have a proper assessment and of the behavioral problems, and where a clear indication is needed, then only the medication is allowed. So medication license for mental health conditions may be beneficial effect for the children with challenging behaviors. So first, the doctor concerned should make a judgment whether the risk or the side effects benefits the obvious side effects. So what are the indication for this medical management? So there are severe and chronic agitation, aggression, and failure for unresponsiveness to psychological approach, and destruction and self-injurious behavior are the most common indication for the medical management. So first, the target behavior has to be identified, and so we have to discuss about the potential benefit, side effects, and course of the treatment should be discuss with the parents and the caregivers. So we have to know about the side effects, so that particularly the derangements in metabolic values and the blood lipid and prolactin levels, which can be shoot up with the antipsychotic medications. So we have to know when to start and when to stop. So we have to revise the effects of the drugs by about 3 to 4 weeks. If there is no adequate clinical response by about 4 weeks, we have to discontinue the drug, and we should have a plan to stop the drugs at 8 weeks, and we should have a plan about the relapse treatment also. The medications are available for following conditions like ADHD. We have stimulants and sleep medications, anti-anxiety drugs. These are the common drugs which are used in the challenging behaviors. We have methylphenidate, atomoxetine, and risperidone, and aripiprazole as the most evidence to be used in the challenging behavior with minimal side effects, and which can be used in the short-term course. But long-term effects of these drugs are not till adequately established. So next slide.
So out of hundreds of drugs, we have selected these 8 drugs which are used in. What is your experience regarding this? Which one you prefer in challenging behavior with some developmental part? What are your personal experience? Any one of your panelists, you can add
more
on to
experience
that.
than me.
Yeah.
Okay, the mild anger and all, rather than going this one, I will always start the SSRI, sertraline. That gives definitely, even for 5-year-old, the temper tantrum and all, after all. This,
Madam, please
counseling.
speak
This-
loudly.
Okay, sorry. Okay, my first choice is the mild drug sertraline, which is an SSRI. Usually we'll give it for OCD and depression and anxiety. But this sertraline can be given for mild aggression as well. It is really effective with not very rare side effects. Okay, so that is the first choice. The second one is, especially with the special needs kids only, we'll move on to the antipsychotics. Kind of the first choice is risperidone. Even risperidone liquid form is also available, especially with the young children, or if they refuse to take it, we can give it easily. If the risperidone is causing more weight gain, then we will move on to the aripiprazole, which is, both of them are antipsychotic. Then for the mood stability, if the first SSRI doesn't work, or this risperidone doesn't work, we will add that anticonvulsant, which is also the mood stabilizer, like sodium valproate. We will add it on. Then the melatonin, that's for sleep. It works for only younger kids or some stressed kids for adolescents. For the challenging behavior, I don't think so I have prescribed the melatonin. Only when they are using the gadgets, if you use the melatonin in the young kids, it will work. But for the adolescents, if they really want to awake, the melatonin doesn't work, so we will move on to the antipsychotic. If the risperidone and aripiprazole don't work, then I'll move on to the olanzapine. The olanzapine, these are all 3 antipsychotic. It has the more drowsiness. We should be careful when they are able to wake up. But some kids, I'll start with the 2.5. They can't even sleep. I have to go up to 5 milligrams. Some kids, even if you give 2.5, even if they are 60 kg, they will say that I can't even wake up in the morning, because I have noticed that it varies to each individual. It is not, even though the research says that based on the weight, the kid's weight, but my experience, it varies to the individual. Like even 25 milligram of sertraline works for 5-year-old as well as the 30-year-old adult as well, because sertraline can go up to 200 milligram.
Definitely.
So we have to start with the lower dose, check the effectiveness within a week, then slowly you can increase it.
You would like to add anything, Vanidhani?
Even while we assess and do a follow-up, sir, some kids definitely need the role of drugs. Like we couldn't do the therapy sessions without the cooperation and compliance.
Yeah, definitely.
So to break through itself, we recommend, and after the drugs, we are better in going and progressing in the therapies.
Yeah, just I can I have one word from Dr. Suchit Tamboli? He is also here and past chairperson of GDBP. What's your take on using these medications in behavioral practice?
Most important is that all ADHD patient, the real ADHD patient needs medicine. They do not recover with only counseling. And ADHD patient, those we can start with the either methylphenidate or atomoxetine, whatever suits that child. and can be used. And it is actually Risperidone is used for ADHD with autism. So ADHD with autism, if it is there, then Risperidone is the drug of choice. So that should be used, and that can be used. And methylphenidate, I have used for more than 16 years for one child follow-up, and he has responded very well. And he that is the longest I have used, I think, and that is very important that it can be used for longer time. There should be drug holidays, like Saturday, Sunday, you should not give medicine. And
Okay, sir. Okay, thank you, sir. So the panel goes with Dr. Vinodini's comment that at some point of time, it's a breakthrough. We should seek the opportunity just to make the family involved, and they should feel that yes, some treatment is going on. So that part is okay. Now, Dr. Subhash, yeah. This was a very interesting review. Yeah, please.
This is a systematic review which suggests that the antipsychotic medicines has a role in the reducing the challenging behavior, but aripiprazole and risperidone has a established effect and the proven effect where there is a, but we have to know about the side effects, which includes weight gain, increased prolactin levels, and sedations. And the long-term consequence of this, the extrapyramidal motor symptoms and the increased prolactin secretion may lead to the, particularly in the adolescents, they may interfere with the physical and sexual development and associated with amenorrhea, erectile dysfunction, osteoporosis. In spite of this, we are using antipsychotic medications for the...
Don't worry, we have completed 77 slides in 40 minutes. That's a huge achievement. Okay, so this is last slide. So there should be a balanced approach, and as you all know, for younger children, behavioral interventions are preferred rather than medication. And addition of medication is needed only if child's target behavior does not improve. In case of older children and adolescents, medication along with behavioral intervention should be considered for effective management. And behavioral therapy within the interdisciplinary model, that is multidisciplinary approach, should also always be there, and these are preferred over medication for preschool children and are adjunct to medication for older children. With this, I once again thank organizing team and my co-panelists. So thank you very much. We are in time. Yeah.
Thank you, faculty and panelists, for a comprehensive discussion on a challenging topic.